Greetings, everyone. Welcome to an Under the Microscope session. I'm Steve McPhail, the Director of OET Online. I'm going to look at speaking today and checking out how you can use clinical communication techniques to enhance your score. So let's get started, everyone. So, quick overview of the exam format itself. Just adjust myself here. There we go. All right. So who will do your interview? One that's really going to be reassuring for you. It will be an interlocutor, not an assessor. So that means you don't have to have any fear. The person taking the role of the patient and communicating with you is not assessing your language. Their role is to simply be an interlocutor. How long does a speaking test take? About 20 minutes in total. That's 20 minutes for you to perform at the best of your ability so you can get the required score. What's the procedure? Well, there'll be a greeting and a warm-up. They'll ask you a few questions about why you decided to become a health professional, maybe what you like about your job, just general questions. That's just so you get familiar with each other. After that, there will be profession-specific role plays which are assessed. And you have 3 minutes preparation for each role play. And how many role plays will you do? You'll do 2. So 2 role plays on different scenarios. And each role play will last approximately 5 minutes. So that's an overview. So now let's look at how to perform well on exam day. So in terms of assessment criteria, there's 2 categories. One is the linguistic criteria, and that's the same in many language exams. You're being assessed on your intelligibility, which is another way to say pronunciation, how clear and how well you pronounce words and the natural rhythm there. Then we've got fluency. And the guide here is don't speak too quickly, don't speak too slowly. You don't want to have too many hesitations, and you don't want to speak so quickly that the person listening can't keep up with your communication. It needs to be just a natural rhythm and flow. Appropriateness of language, that's related to vocabulary and also, as a health professional, you have a lot of jargon that your patients may not understand. So you need to be able to express technical jargon in easily understood language by the general public. And resources of grammar and expression, again, that relates to accuracy with your questioning technique, sentence structure, verb use, and also vocabulary range. All right, now that's something that many of you will already bring to the table if you've been studying hard. You might already be quite confident with linguistic criteria. However, category 2 is a communication criteria. Now, this is a clinical communication skills, relationship building. Are you able to build a relationship with your patient, build rapport, show empathy, make them feel good, and know that you're supportive? Very important. Understanding and incorporating the patient's perspective. That means active listening, identifying what the patient's individual problems are and providing solutions to those problems. It's not a textbook case, you're talking to a real person. You've got to provide structure to the role play. That means you're in charge. You lead the role play. You move the communication forward at appropriate times, and you dig deeper and probe further at appropriate times, as required for you to successfully take a patient history and provide appropriate advice. Information gathering, that really is gathering information about the patient's history and with a good questioning technique. And information giving is giving advice, treatment options, management, and so forth. So all of this is part of the communication criteria. And the good news is this communication criteria is independent of linguistic criteria. So you could perform well in the communication criteria. If you're good in this area, that's going to boost your overall score. So it's not based just on linguistic. There are two elements, which is unique for OET. So let's look at one aspect of the communication criteria, which is relationship building. Now we can break this down further and bring in some linguistic elements which relate to embedded questions. We're going to give you some, help you with empathy, showing empathy and following up with reassurance, and also the benefits of using positive language to build rapport. Right, let's start with embedded questions. And this is a polite way to communicate. So it's a very natural and important thing to do, but it requires a bit of grammatical knowledge. So we can have a direct question. Why have you come here today? That can sound a little bit harsh if that's your opening sentence. But if we embed it, could you tell me why you've come here today? All right, so what have we changed here to make this different? Well, it's these two words, you and come. Can you tell me why you, and we've got here why have you? So we've changed the order. We've put the you before the have. Can you tell me why this is a contraction, why you have, why you've come here today? So we change the order. All right, let's look at another one. How did you injure your knee? This is different. Could you tell me how you injured your knee? Now, in this case, what we do, if we have our auxiliary verb, did we remove it? Could you tell me how you, and this past tense, this is a past tense verb, we turn injured into the past participle. Could you tell me how you injured your knee? All right. What time did the accident happen? Let's try that one. Do you remember what time the accident happened? Okay, we did the same thing. We removed the did and we put the ed on happen. So we've got a pattern. Same one on the next one. Same thing. When did the pain start? Could you tell me when the pain started? Again, on both these options, we've removed did. Right, a little bit different structure on this one. How long have you had the pain? Could you tell me how long you've had the pain? So again, after how long, we're putting you before the have. All right, that's how you do it. Could you tell me how long you've had the pain? Now this next one's different again. Is it a sharp or dull pain? This is a yes/no question. Is it a sharp or dull pain? Could you tell me if, now we incorporate if, could you tell me if it's a sharp or dull pain? All right, so we change the structure. Could you tell me if, and we put it, we reverse the order. It comes before is. So we're changing the order. Does the pain bother you at night? Could you tell me if the pain bothers you at night? Could you tell me if the pain bothers you at night? Last one, why do you want a prescription for sleeping tablets? Can you explain why you want a prescription for sleeping tablets? So we've introduced a new word for why. Can you explain why you want a prescription for sleeping tablets? Now, these are challenging grammatically. So one thing I say to you, video watchers, is practice these patterns. Take a screenshot of this and make sure you understand these rules. You're not going to have to ask a lot of embedded questions in your role play, but it's very common to ask one or two, particularly at the beginning of the role play, and perhaps at some point of transition or when you need to probe deeper. Accuracy in this area is something that will be identified by your assessors, so well worth building your skills on. Of course, at OET Online, when you study in our speaking courses, These are exactly the kind of things that we work on in detail to help people improve their communication skills. All right, now that's embedded questions. Let's now look at empathy plus reassurance. So I've got a bit of a dialogue going on here, everyone, and we've got patient language, and we're going to look at the health professional's response. So patient says, all right, but I've heard about severe side effects from chemotherapy and radiation. That scares me. What if my hair falls out? So the patient's expressed a concern. You've got to respond to that. How do we do it? Well, first we show empathy. It's true that a lot of patients experience hair loss with this treatment, all right? So you're paying attention, you've listened, right? And you're acknowledging this is true. It is also common to experience some nausea and vomiting in the early days of treatment, but please don't be worried about these side effects as they are only temporary. So there's your assurance sentence there, and I think that's quite an important sentence because we've got a reason. But please don't be worried about these side effects as they are only temporary. They're not going to last forever, right? We keep going. We can give you medications to stop the nausea. Your hair will grow back again, and in the meantime, you can wear a wig or a scarf. So we're providing solutions. So we've empathized with the patient's concern, and we've provided reassurance. It's practical, it's real, and it's a good long response, right? So a good rule is when the patient says just one sentence, you try to give a longer response to provide that reassurance. Let's try another one. That sounds terrible, nurse. What are the risks of this disease and how can we cope with them? All right, let's look at our response here, everyone. Now, just a little error there. Let's just remove that. How can we cope with them? Well, Mrs. Johnson, I can see that you're very concerned. Now, that's a very good sentence. Might sound really obvious to you, but that's very important that you make that statement. I can see that you're very concerned. I like that type of sentence. That's showing that you're listening, right? That's empathy. Let me reassure you that if we control his sugar levels with the normal range of proper medications, Tom can live a normal life without any troubles. However, there are two common complications that may occur which you need to keep an eye on. Sometimes the blood sugar level can be too high, sometimes it can be too low. All right, so we've spoken about risks, we've responded to the patient's question. We've also said what we need to do, keep an eye on them, and we've given them the two possible examples, all right? But lots of reassurance. Tom can live a normal life without any troubles. That's very reassuring for the patient. So it's very clear. Next one. Well, actually, it's the word steroid, says the patient. Steroid is a banned drug, you know. The Olympics have just been on. I've been watching the Olympics and there's been a lot of talk about illegal drug use and banned drugs. And always the word steroids came up. So I suppose I just feel they must be bad for one's health. How do we respond? Let me assure you that we have over 200 types of steroids. It's a large family. It's not a bad word, actually. The corticosteroid you've been prescribed is totally different from the one used in the Olympics. For you, the corticosteroid medication is very safe to use, right? So you're responding to perhaps that patient's misinformation and giving them a detailed response. Now, the good news is with OET tasks, they give you this information. You don't have to create it. They're quite supportive in the content of what you can say in response to a patient's concern. Your job is to use that information in the card and expand on it, right? So preparation and practice building those skills can really help you. But remember that pattern: empathy plus reassurance. All right, that's one strategy. Let's look at another one. Positive language. One of the most important and probably easiest things that you can do to build rapport with a patient and build their trust and let them know that you care. So here's a good one for the vets. And why is de-sexing recommended? That's a good question. Just that simple statement. That's a good question. You see, as well as reducing the number of unwanted puppies, de-sexing prevents pets from roaming, fighting, or causing a nuisance to neighbors. So you'll have less to worry about. All right, so that's very positive and good explanation of the benefits of de-sexing. Patient. Does this Patient, does this quit smoking program really work? I'm glad you asked. Yes, it does have a good success rate. Many of my patients have attended the quit smoking program and as a result have been able to quit smoking successfully. I'm sure it can help you as well. If you like, I can set you up for an appointment with the program coordinator. How does that sound? Now that's very proactive and a good statement. First of all, we're being positive, that was a very valid question. Then we're reassuring it does work, it has a good success rate. Drawing on past experiences with patients is a good way to reassure. Remember, you're acting here, right? You're acting as a health professional, right? So for that, you can expand and you can say that you've done this program before and that it is successful. Because in real life, this would be the case. So you're acting. And I like this bit. If you like, I can set you up with an appointment with the program coordinator. That's practical because in the real world, that's what you would do, right? So you're providing these solutions and then you're making sure the patient is on board with that. How does that sound? The patient will then have to respond. Hopefully they'll say that sounds good, or they might have a concern that you can address as well. But practical things like I can arrange an appointment is very useful. Next one, I'm so worried. Maria's never had an operation before. Are there any risks? I do understand your concerns. Well, there are concerns, risks. I do understand your concerns. Let me explain that there are certain risks with any surgical procedure. But let me reassure you, the staff here are very experienced with tonsillectomies and will take good care of your daughter. And serious complications are very rare indeed. The good news is it will reduce the number of infections and lead to better health. So that bigger picture overall. That's natural language, that's reassuring, it's being positive, and it's aimed to reduce any concerns that the patient may have. So at home, have a think about some of the common things that might cause concern among your patients, and how would you as a health professional deal with those concerns? Make sure you incorporate positive language into your responses. Okay, now this one's a little bit different. This one's risks and consequences. And I'm introducing this one because you might get non-compliant patients that won't necessarily follow your advice. How do you deal with that? Well, one way to persuade them is to explain the negative outcomes associated with a certain action. In other words, a non-compliant action. What's going to happen? You need the ability to expand and provide longer and more detailed responses, which is very good because that increases your talking time, which is very good for your assessment. You need to be able to demonstrate you can string multiple sentences together and will help you convince the patient to follow your advice. This can be challenging. So you might ask a patient, I need you to change your lifestyle. We know changing lifestyles is not easy. Patient, I don't think I can change my lifestyle. Your response, I do understand, but if you continue to eat an unhealthy diet and do limited exercise, you may put on more weight, which can in turn lead to a range of negative health outcomes, such as high blood pressure, type 2 diabetes, and heart disease. That's why it's important to make some lifestyle changes now. Do you think you can do that? All right, and this is great. Do you think you can do that? You're putting ownership to the patient. They must take charge of their own health, right? So that's very useful. Patient, I don't want to get out of bed today. I just want to rest. Well, that may not be in your best interest. The doctor said you need to start mobilizing today. If you stay in bed and don't move about, it may take longer to recover, and you'll be at increased risk of developing bed sores and chest infections. On the other hand, if you start moving about, you can build your body strength and your independence. This will help you get ready for discharge. How does that sound? So again, we're talking about the negative consequences, bed sores, chest infections, and we're also talking about the positive implications of following the advice of the health professional. Last one, I really need to start work straight away. I don't have time to just lie around. It's natural to feel that way, but if you go back to work too soon, then you may not make a full recovery and your condition could get worse. The best advice right now is to get plenty of rest. Ask yourself, what's more important, your long-term health or your work? All right, so in these risks and consequences, we've used lots of if sentences to help you, these if clauses, conditional sentences to talk about the outcomes which could occur. Make sure you practice this skill, the risks and consequences of not following your advice. Remember, as health professionals, you're in charge of the communication, and this is a real skill that comes up on many of the role play scenarios that you could face in the OET exam. Practice is the key. If you develop this skill, you'll be really improving your or the effectiveness of your clinical communication skills. Right, now I'm going to give you an example. So this is a diabetic foot one, and we're going to have a little bit of a dialogue. So we've got a patient, they're 60 years old, they've got type 2 diabetes, and they've had it for about 12 months. And they've come to the clinic because they've sustained a cut to their foot, right? And it's now inflamed and swollen. So the patient's got to describe their symptoms. They've got to say how the cut occurred. They've got to say they thought it was a minor cut. They've got to be defensive because they didn't realize it would become infected. And they've got to express shock that it could lead to serious complications. So patients have a role to play that's written on their card, and they're going to follow that script, right? And you don't know what that script is, and some parts of those and some sections of that script will be unexpected. There's like an information gap. What OET Center wants you to do is respond in a natural way to what the patient says. So you really got to be listening and responding. Your card has the same background. You've got this patient with the inflamed and swollen foot, and the patient is seeking medical advice. So your task, ask about the patient's presenting foot symptoms and explore how the cut occurred. I like this word explore. That means you've got to ask several questions, right? A lot of people rush through this, don't ask enough questions, right? So you've got to ask enough questions. You've got to explain the risks of delayed treatment, right? And good thing about OET, they tell you those risks that could occur. So you can expand on that. You've got to give instructions on foot care for diabetic patients, inspecting the feet daily, looking for signs of the cuts, blisters, swelling. And you've got to stress the importance of good foot hygiene. Now, you don't have to create that. They tell you what good foot hygiene is. Keeping the feet clean and dry, especially between toes, keeping the toenails trimmed, and so forth, right? So all that information is there to help you in your communication. Lastly, recommend referral to a podiatrist. Okay, let's look at our dialogue, shall we? So, and this is just a mini dialogue, just to show you the skills. Nurse says, "Good morning. I'm one of the nurses here at this clinic. Can you tell me why you've come here today?" There's our introduction plus a polite or embedded question. Can you tell me why you've come here today? Patient, sure. Look, I've come here today because one of my feet is quite infected. I see. Would you mind if I have a look, please? Again, we're seeking permission. It's an embedded question, not, can I have a look? Would you mind if I have a look, please? Sure. I can see there's a lot of redness and swelling. It must be painful. Yes, it is. Well, don't worry too much. We'll get it cleaned up and in a moment. But first, I'd like to ask a few more questions. Is that okay? So we're showing empathy here. Don't worry too much, because we're going to clean it up. But we're also seeking permission to ask questions. That's very respectful, helps build that rapport. No problem. Firstly, could you tell me how you cut your foot? Right, signposting with firstly is good, and another embedded question. Well, I was out gardening and I stepped on the rose thorn, I think. Just a minor cut, I thought. And when did this happen? About 3 weeks ago. How did you treat the wound afterward? Nothing really. I mean, I washed it and then put a bandage on it. I see. Did you change the bandage regularly? No, I just left it. I see. Well, at this stage, your wound is quite infected. Is there any reason you did not come here earlier? Right, now you can see here a lot of probing, a lot of questions. The questions are direct. No need for embedded questions here now as we get into the actual essence of the problem. So very good questioning technique, and that's getting your back and forth communication, which is what you want. It's not a monologue. This is a dialogue. So you want that question response situation. And keep going. Patient. It was just a minor cut, nurse. I just thought it would heal by itself. Okay. Well, that was not really a good idea. As you have diabetes, your foot may heal more slowly, leaving you prone to bacteria, which can cause infection and ulcers to occur. If the infection spreads, it can even lead to an amputation. Oh dear, I'm not going to lose my foot, am I? No, you're not. And the good news is, I think we've caught it in time and we can treat the infection. But you must remember to take all cuts seriously. And if you see any signs of infection, you must visit the clinic immediately. Okay, nurse, I will. All right, so that's an important section of this role play. The consequences have been explained. We're not saying it will, it can even lead to infection, amputation. It's a possibility. They're not saying you might lose your leg, it's just a possibility. But when the patient asks, you say, no, you're not. Just letting you know these are potential consequences. All right. Now, when the patient says, I will follow your advice, nurse says, that's good to hear. There's that positive language. Now, the doctor will see you soon. But before that, I want to give you some general advice and foot care. Is that okay? Now, this important word here, everyone, is the word now. This is how you move a conversation forward, right, to the next stage. That means you're leading the role play. There are a few things you can do to keep your feet in good condition. Firstly, I recommend that you inspect your feet every day. Do you think it can do that? All right. Yes, but what am I looking for? That's a good question. Keep your eye out for any minor cuts, blisters, and or swelling, those sorts of things. Again, what am I looking for? More positive language. Right. You'll need to keep your feet clean and dry. especially between your toes. If you don't, it can lead to cracked feet, which can then become infected. You don't want that to happen, do you? Not at all after this event. Nurse says, I would also suggest keeping your nails trimmed. Can you manage that? Well, I can, but it's a bit hard. I find it hard to reach my toes. Yes, I understand that can be difficult. Perhaps it's time we referred you to a podiatrist. That can help with foot care. How does that sound? Sounds like a good idea. Thank you, nurse. All right, so lots of stuff going on. Lots of great takeouts for you here. I like this last one here, or two of them. One, can you manage that? Remember, once you give advice, then ask the patient, can you do that? How does that sound? Is that okay? These follow-up questions ensure that the patient must respond and take ownership of their own health, right? So the other really important thing, the patient identified a problem, right? They can't reach their toes. So understanding that can be difficult. And there's a solution. Let's get you to a podiatrist. Podiatrists can do these things. So one of your jobs is to provide solutions to the patient's problems. Think about it like that. Patient presents with a problem, you come up with a solution. So in essence, for speaking, a few little tips. Use the KISS technique. Keep it simple, Simon, and use easily understood language, so avoid that medical jargon. Chunks and checks, no monologue, it's a dialogue. Chunk and check means give a chunk of information, not too much, not too little, and then check the patient understood. Allow the patient to ask questions, right? Do you have any questions so far? Pause between what you're saying. Leave little options for the patient to interject with their questions. It's not a monologue. Use the patient's responses and questions to guide you how to proceed. Don't be too card focused and you're just saying what's on your card. You must listen and respond to what the patient said. At the end of the day, it needs to be natural. Offer choices and involve the patient. So you're going to make suggestions. And for example, you need to exercise regularly. Do you think you can do that? Again, that's involving the patient. I can arrange a community nurse to provide support at home. How does that sound? These techniques enhance communication and help you meet the OET speaking assessment criteria. All right, put all those things into practice and you will be on your way to a successful speaking result. Now, a few more things I want to share with you, everyone. So I recommend you come to the OET Online website. And if you want to enroll in a structured course that will help you achieve your goals, then we have that for you. So we have courses for all professions, right? And we're fully endorsed by the OET Centre for all 12 professions. That means they've audited our content. We've worked together in partnership to make sure that our courses and our content matches that provided by the OET. We're the only provider with endorsement for all 12 professions. We have a free taster course, includes a free live lecture. So come and check out our free taster course and jump into one of our live classes to find out what we're all about. I'm sure you will find it very effective in helping you prepare. We have been voted the #1 provider by the NHS. We delivered programs to help nurses get into the US, into the UK. And at the end of that, we were rated the top provider. Top in terms of we had the highest exam pass rate, the highest student satisfaction. We had the highest response for student queries, and it was also the best value for money in terms of courses offered. That's a pretty big endorsement, everyone. We're very proud of that, and it just demonstrates that we take our job seriously. So if you want to study with the #1 provider by the NHS, join OET Online. What do we offer? Well, we make all our own content. It's all original, and it's all exam quality. And we keep updating things as the exam evolves, including tips and strategies to ensure you're on track. Our teaching team monitors what the OET does. We work very closely with them. And as they inform us of new areas to promote for students, we keep very much abreast of those changes. We also have mock tests to gauge your level, which can be very useful. For writing and speaking, we offer private one-to-one tutorials and expert corrections and grades via email, and we can create personalized study plans for you as well to help you achieve your goals. You know, when you study with us, that the quality is guaranteed. As I said before, we're that premium provider for all 12 professions. We've been doing this for well over 15 years. Experience counts. Look, we have live and interactive lectures every day, twice per day on Zoom at convenient times for no matter where you're located in the world. But we also offer recorded videos of our past lectures so that you never miss a class and you can review at your convenience. This helps you focus on your area of need as well. And remember, every week we have 30 hours of live lectures. So you can pick and choose your focus, whether it's writing, reading, listening, speaking, or grammar. You have that possibility. Our partners, well, we're a premium preparation provider with OET. We're also an All-Stars, which again, just shows our commitment to OET training. We work with other organizations such as Atlantis and Core and the Capital Nurse recruitment program, which is part of the NHS, and Health Education England. Now, when you go to choose a course, you just click on your profession. I'll use the nurse example. You have 4 types of courses. You have All Skills Plus, All Skills. What's the difference between these two? Well, the Plus has more one-to-one tutorials. A lot of people want private tutorials working with a private tutor. You'll get that in your Plus. You also get it in your All Skills courses, but these have a bit more of a writing focus as well. So if writing is your weak area and you want lots of correction, go for this one. If you pass 3 skills or 2 skills even, and you have 1 or 2 to go, check out our single skill options. And lastly, if you have an exam coming up and you want to do a mock test to simulate exam conditions, we offer that too. So you can find all of this on our page, everyone. And the last thing is, if you're interested, all you've got to do is create an account on our website. And oops, that wasn't how you do it. Come to our site, create an account. If you don't have an account, click on the link. Oops, not doing that right at the moment. Yes, but just log into our site and you will be able to select a course and continue your study with OET Online. So do that, everyone, and you will be on track to passing OET. And this is here it is, everyone. There's your create account page. Check that out. Create an account. And join us, join our community of health professionals, and we'll help you pass OET on your next attempt. Bye for now, and good luck.